Good morning, and welcome to today's Tuesday's edition of Island Tea. It is February the 4th. Today's also Bile Duct Awareness Cancer. Well, the entire month is, but I think today begins the awareness of cholangiocarcinoma. That's the scientific name. Also known as bile duct cancer, is a type of cancer that forms in the bile duct. So the doc won't be in today for weekly dose, but we'll keep you updated. So we'll be talking about bile duct cancer this morning in the absence of the doctor. But good morning, St. Kitts and Nevis. How are we doing? Good morning to the regional and international diaspora. Today is Tuesday. Remember, we can choose to be kind or we can choose to be unkind, but I hope we choose the former. So I just want to say good morning to all of you that tuned in this morning. Good morning, Cleo. Good morning, Skeeter Mills. Good morning, Carla Astafan. Good morning, Mr. McMahon. Schneid. Good morning, Gawain. Good morning, Beatrice. Good morning, Javan and Dennis. Good morning, Miss White. Good morning, Miss Nisbet Richards. Good morning, Miss DeGuaya. Good morning, Cathy. Morning, Mishi. Morning, Colleen. Morning, Mommy. I know you're listening in. Diana Ellen, Diana H. Good morning, Rusty. We miss you. Good morning. Good morning, Burl. Good morning, Chevy. That's Chev Rich right there in,
The
I
big
think, SB. SB, hear me, SB, SP where the best be, but it is where the Sandy Point Benevolent Society is from. Good morning, Mr. and Mrs. Isaac, good morning, Fidel, good morning, Boxer, good morning, Edith Bradley, good morning, Mario over there in Nevis. Jermaine, good morning, I don't want you coming for us this morning, so good morning. Miss Henry, good morning, and UN, good morning. I know there are many names, but I can't call all. Yeah. Dara, good morning, Brent, good morning. Jam Down, where is Jam Down? How come we haven't heard from Jam Down in a minute? Jam Down.
I saw him, when was it? Saturday or Friday, I think. Yeah. And he said hello. Yeah, I was on my phone at the time, so he was kind of off, but yeah, on 4th Street somewhere, I think.
Okay.
Yeah.
Oh boy, Jam Down, we miss you. Culture, good morning. Elder, good morning. Dumpling, good morning. Oh my gosh. Good morning to everyone whose name I didn't call. You can let me know. Next time I'll just might call you. Good morning, Miss Wall.
Yeah, good morning, everyone. No, I'm not doing the list thing like she does. It's not going to happen. Doesn't mean I don't love you guys.
Morning, Shine.
You either.
Oh boy.
No.
You're rough. Good morning, AZ. And good morning, Candy. Yeah, I think I touched everyone. So, Jamsta, what's on your radar to begin the day? As I told him, the doc won't be in this morning, but we'll be talking about.
One thing that struck me until I heard the reason, that the tickets for Super Bowl are less than half the price of last year, most of them. And I was like, well, why would that be? And then the reason revealed itself. Last year, it was in Las Vegas. So, I mean, who doesn't want to go to Las Vegas? And New Orleans doesn't have the cachet like Las Vegas. You know? Yeah, I mean, remember Las Vegas is like an event town, a spectacle town.
But New Orleans is an event town and all of that
yeah,
too.
But not.
That's why I'm looking like.
No,
what?
but not on the level like Las Vegas. Las Vegas is a glamorous town, right?
How?
Yeah, it's
Las
sort of
Vegas
like.
is just dry and just have.
You've been there?
Hotels and no.
Yeah, but people
Snakes.
people prefer snakes. Well,
Yeah.
or the two-legged
and
ones.
Elvis impersonators
The
galore.
two-legged ones, you mean?
No.
Okay, well, I'm sure there are lots of those. Yeah, but no. I mean, I get it. It doesn't have as much cachet as New Orleans. It's like.
Oh, though.
No,
you see
but
how big they make New Orleans.
Okay, let's use an example. If someone was having let's say a conference and you had two choices. The choices were Ramada in St. Paul's or
oh my God! Why you gotta?
Or Palm Beach. Which one would you choose? Or even
Palm Beach.
say Ramada in St. Paul's or
Depends on my
Marriott
pocket.
or Marriott. Which one would you choose? Now be honest. Which one would you choose?
Marriott. Why? Let me explain. It's closer for everybody. It's centralized. Ramada, we have to go.
But we're
all-
not talking about everybody. We're talking about you.
I thought
Okay,
you said
for everybody. Okay,
conference.
for everybody. Okay,
yeah,
go ahead.
I
Yeah,
was doing
okay.
conference. But for me, I will go behind the land. I love quiet. I love peace.
But you would be in the
I like
minority. Most people would choose Marriott.
Oh no, that's too noisy. That's too busy. Yeah.
Yeah,
I'ma
or
go
somewhere in town.
Quiet
you know.
or to Nevis, my favorite place to be overseas. Yes, and I'm literally going overseas to get there.
But yeah, I mean, it's not gonna have the same cachet as New Orleans would never have this. It's just like if the choice was Los Angeles and New Orleans, Los Angeles would probably win. You know? No, but it's true. No, it's not a knock on
I
New
just
Orleans.
think they have their own style.
It's-
but I
it's
don't
not a
think
knock
one
on
is
New
superior
Orleans,
than
you
the
know?
other.
No, but they're not. They both have their own unique attractions and unique charms.
You're right, because it depends entirely on personal preferences.
Yeah, so that was the reason given that you'd have to go to New Orleans to see Kendrick Lamar. Which is,
No, you can still see when he goes anywhere else in the U.S.
True. But you're not gonna. That's probably the only time. At least that's the only time that we know we're gonna see him along with.
You know what? New Orleans save you money, so go to New Orleans. Because,
Yeah, that too. Exactly.
Because in Vegas has casinos, extravagant
Exactly.
shows.
That's
Hold up.
precisely my point. All
and
of that.
nightlife.
All of that.
So you
Everything
spend
is
out
more
your money.
expensive. Everything
Yep.
is more expensive. But
Well-
it's also more desirable as well. Like I said, it's not a knock on New Orleans, but most people, if they had the choice,
Oh,
yeah. I
I
mean,
don't
you know.
understand how.
Yeah.
While New Orleans is celebrated for its rich culture, unique cuisine, and vibrant music scene. Remember, you get the blues, you get to feel like you've been around the BB Kings and all those folks there in New Orleans. The only person you feel like you're around in Vegas is a hunker burning love, Elvis. Because everybody wants to be Elvis.
It's too funny.
Yeah. But to each his own. To each his own.
So, what else is going on in the world?
What else is going on in the world? Oh my God, lots of things. Lots and lots of things.
Okay.
You know, the
So-
trumpeter passed away, so condolences to his family.
The Trump who?
The trumpeter that plays the music in the morning on the road.
Really?
Yeah.
Oh.
Yeah, so condolences to his
Okay.
family. Yeah.
Oh, okay.
Yeah. Is that when I saw that yesterday, I was like, oh boy, that is so sad.
But you know, I've never seen him.
Never?
I've heard him. I've never seen him. It's
You never
funny.
looked to him though.
No, I'm not nosy like that. Like,
But you don't have to be
no, as a
Don't
nosy.
you want to know? Since you're into music, wouldn't you want to know who's playing the horn? Doesn't this horn
I
make you
think-
think he should be part of the Christmas celebrations?
yeah. What happened is, no, I'm a kind of person where if I'm doing something and there's something, like for example, you'll have an accident going on and everybody rushing. Not
I'll
me.
go the opposite way. That's me
I'm
too.
like, I said no, I can
But
find
I
out.
want to see who's
I'm
playing
like, I
that.
can find out what that is later. I don't need to see, you know.
Yeah.
So a couple times I've been in town and I heard the person playing the trumpet. And I might have been in the circus and I hear it like up 4th Street, but I'm not gonna go up 4th Street just to see who it is.
Oh, so you don't walk at 4th Street?
No, I walk up, but then I think maybe if I had gone up 4th Street, I probably forgot. Maybe I didn't hear him again and didn't look to see who it was,
Oh,
or I didn't remember to look to, you know.
yeah.
Yeah, I've heard of him, but I've never seen him. At least I've never seen him playing the trumpet. I'm sure I probably know what he looks like, but
Don't know the name
Don't know
Elvis
that- don't
Thomas doesn't ring a bell?
no. Elvis Thomas?
Yeah, that's his name.
Mm-mm. Is he light skinned?
No, he's about your color.
No. Mm-mm.
Yeah.
Mm-hmm.
And you're not dark skinned, so.
I
Get your
am
li-
dark skinned.
No,
What are
you're
you
not.
talking about?
Oh boy.
I use the darkest, you know, on WhatsApp where you can choose the color, right? Like for the
Yeah, for
thumbs
the
up,
avatar.
I choose the darkest.
Oh my God. You.
Yeah. That's about my
oh.
color.
I'm not even gonna argue color with you because you know it's
Me-
also Black History Month.
Me and you're the same color, actually. Roughly.
Okay. We're not gonna argue.
But you don't consider yourself dark?
I'm not that dark.
Okay.
No, so I'm not gonna use the darkest avatar. But I'm not going to use the whitest one either because that's not my color.
Mm.
Or the fairest one. No white. White is a color.
Or yellow.
I'm not yellow at all. I don't want to be yellow. Oh.
Because I just thought it was an odd color. Well, I guess it's a color that they choose so they wouldn't get in trouble, because you know what people would say. Oh, you made the avatar's default color white, so they made it yellow so people couldn't hack you. And then eventually, they added the different shades.
Mm-hmm.
Yeah.
Of course, yeah, because it stopped at yellow. Jermaine says, "What is Jamsta's color?" So Jamsta, you could explain to Jermaine.
I'm dark.
Oh my
No,
God!
I always thought of myself as dark. I don't know.
Mm.
I don't know.
Oh, so he got his skills from. Apparently, he was interviewed by WinFM in 2022, where he said he gave credit to the Defense Force for the development of his skills. When I came home, they recruited me to play, and when they found out who I was, they put me in a position to teach. They actually created a position for me to work at the Defense Force. I kneel to them for that. I thank them so much. Those are the people who started me in St. Kitts when it comes to music, Thomas stated. Oh, Thomas was also a musician with the Legends Band. I don't know that band. Maybe you might know it, Jamsta. Providing
Yeah,
music.
that's Socrates' band.
Oh, providing musical accompaniment. Oh, so he played for Calypsonians during the Calypso tents. Okay. And there's me thinking he didn't do that. He said something he felt was missing from Calypso. Something he felt was missing from the Calypso art form in St. Croix where he wants to live. He preferred genres of music to play were concert jazz and religious music, yeah, because he starts off the morning on 4th Street because he's normally right there by Polo Company and Lucky's, yeah.
Okay.
And to end this out, it said, in a more recent conversation with WinFM, Thomas, in his Crucian accent, said, "I love to make my people smile. I love to live the spirits of my people. That keeps me motivated to do this every day." So may Mr. Thomas's soul rest in peace, and we send out condolences and sympathies to his family on behalf of us here on Island T and the entire WinFM family.
Oh, yeah. Meanwhile, there's an article here about St. Kitts and Nevis Grammy history. Let me see what it says. I mean, you guys know that. Oh, yes. Okay, I remember now. I was called last night about someone I would have interviewed someone I interviewed in the past who was Kittitian and who'd won a Grammy, but I couldn't remember who it was. But
Who is that?
I think Joan Trading. I remember now. Yeah, I didn't remember that. Yeah.
Ooh.
Yeah, Joan Trading, born in St. Kitts, the iconic singer-songwriter, is a 3-time Grammy nominee. Nominee, that is. She never won, but then there's Leslie Brathwaite. He is a Sandy Point rooted music producer and audio engineer. I think he's been involved with people like Monica and Dallas Austin. TLC and so on. Can you imagine? Yeah. He has 1 Grammy win and 7 nominations. And then you have Taj Mahal. Yeah. Taj Mahal is a blues guitarist with deep Kittitian roots. His father hails from St. Kitts. The legendary blues musician has won a staggering 5 Grammy Awards and received 17 nominations throughout his illustrious career. He actually performed in the St. Kitts Music Festival one time. And of course, Byron Messiah, just scored himself a Grammy by way of Chris Brown, being part of Chris Brown's 1111 album. Do you know another R&B artist had an album called 1111? Keisha Cole. Yeah.
So
exact
how come
same
he
name.
realized that he named his?
Yeah, he probably didn't realize. I'm sure if he had realized, he probably would have used.
Maybe it's his producers too.
Yeah, 1111. Yeah, so that's some Grammy history there for people wondering what Kititians have been doing on the Grammy tip. Oh, but we also actually I need to let my friend know. He probably needs to include Angie Stone. I think she's been nominated, and Angie Stone's parents are from Nevis. Yeah.
The Angie Stone.
The Angie Stone.
Oh.
Yeah.
Okay.
I think she may have been nominated a couple times as well. So you'd have to include her as well.
Yeah, I didn't know we have people that win.
Yes.
Yo, social media is rough, you know. Go ahead.
Okay. And Donald Trump's destruction of the U.S. government, U.S. government, let's say agencies, continues apace. USAID has been shut down. Elon Musk is running amok.
Yeah.
Donald Trump announced. Apparently, the U.S. law says, well, you're either a government employee or you're not. But Donald Trump is basically saying, oh, he's in between. He's a special government employee, so he's not a government employee in the standard sense. But he's not completely on the outside either. So I don't.
But you see, that's why we have to be mindful who contributes to our campaign, because I think he's given so much that he feels he deserves a spot.
Thank you. Which leads us to that topic you wanted to talk about.
Yeah.
Great topic. Folks, we would love you guys to weigh in on this.
As well. I see Australia put a cap on how much money people can donate, and then there's $1,000 for let me pull it up. That some parties are saying that's not cool because the smaller ones would suffer while the big ones continue to thrive ahead of them.
I prefer and I would like callers to call me and tell me what you think.
Donations, because when you donate to government, shouldn't it be out of the goodness of your heart, very well knowing that they have a campaign to run and they need monies to pay the bills for the speakers they're going to use, for the chairs they're going to have, for the tents, etc., etc.
But I think that campaign financing should be public. It should be publicly funded.
So we
just
should,
like Canada.
But it says it was back in the day, because I was reading an article that says that it was.
Yeah,
give me 1 second. Let me put up my article.
Money changes everything, like Cyndi Lauper says. No, it's true. I mean, everything just goes. From the time big money interests get involved, you can just expect anything to happen as far as shady stuff and all of that. Let me see. Let's take a call here.
Okay.
In Canada, for example, there's a set amount of time for a campaign. I think it's 2 weeks or 3 weeks. And there's a set amount of money that each party gets, and that's it.
And they tell you, where do they get this money from?
Call
up, please. No,
public money.
Oh, it's public money,
Yeah,
so they're never funded by private corporations.
For the most part, no. Caller, go right ahead.
Good morning.
Yeah, I knew it. Somehow I knew it was you.
Yeah. Actually, it is really saddening to hear of Thomas's passing. It was like a breath of fresh air in the morning if you go downtown early in the morning.
Yep.
And you hear the tones coming from his playing. You know, before the traffic started and so on.
Yep.
Right. And I think most people who would have had cause to go downtown would probably miss it. It's unfortunate. Well, I don't know if it happened, but something like that, I think, somebody like him, I think, should have been regarded as an icon and rewarded in some way. I mean, even if it's just breakfast in the morning. You know, but I guess, you know.
Well, we don't know if somebody did that for him, though. You think?
Well, yeah, it could well have been. But I suspect that it was mainly out of love for, as he said, making people smile and so on. Yeah. That he did this. He did this. Okay, and that was a really good gesture from him. to me, something like that is worthy of an award. Something like that, as opposed to all kinds of strange stuff that they bring up. With regard that campaign financing, there are some things that are so easy that they're so hard to do.
Yeah, and
It can easily be done, but yet the will isn't there to do it. And campaign financing is one of them. You can't tell me that a simple law can't be passed, not preventing, not putting a cap on it, but at least making the parties declare the source of funding. Because obviously it has consequences after. A lot of this stuff, the bad stuff that happens here, is because of that, right? People feel entitled because they contributed financially.
But should they, though?
Should they do what?
Should they feel entitled? Isn't it just giving to ensure that, the best?
If you believe there is such a thing as a freelance use for that, but the thing is, nobody is going to pull out the hard-earned money and just give to a cause on principle.
Okay.
That doesn't happen anymore.
Okay.
Okay, nobody is willing to make that kind of sacrifice, right, for something they really believe in. They might believe totally behind your policies and so on, and so they have the money and so they contribute. That I don't think happens often anymore, right? And so you could expect that, say, there's some quid pro quo involved, right? And you hear rumors of without campaign financing legislation, you can't verify them, but you always hear rumors of companies, some unknown company somewhere coming in after and getting some big contract. And it continues. It never stops. And that's why I say it's easy, but it's hard. Okay? Because it's like the incoming administration sees it as a way to maintain themselves in power. Okay? Because, as you well know, campaigns are expensive. They really shouldn't be. And if there's public financing, because that's the other controversial thing, if there's public financing for campaigns where you put a cap, I don't know how they divvy it out, but there's some public funds for campaigns, and or maybe you can say matching funds then for campaigns.
Yeah.
And you have a cap on it after that, because the spending is ridiculous. Utterly ridiculous.
But
and in a sense, it's treating. It is what you call treating.
It is. And it borders on bribery too.
Yeah, that's what I'm saying. It's treating. It's bribery. Okay, and but you can bet your life that no party in power, because that is where it has to originate. Everyone to have the power to change things. Are going to take any steps in that direction. And that's the unfortunate thing. It would be good for our democracy, but they're not going to do it, because it's just like integrity legislation and so on. Sure, they'll make cosmetic stuff, pass legislation and so on, but there will always be a loophole to cover their backs.
You heard what you
because
just...
Nobody going to give other people rope to hang themselves with.
You heard what you just said? It would be good for the democracy, but somehow the politicians...
would be good for democracy.
The politicians wouldn't do it. But how is it... But somehow we never think that the politicians aren't good for democracy or aren't good for governance or the common good. How is it we never think of it that way? Because
the politicians, but politicians are necessary, right? I mean, somebody got to lead, somebody got to implement stuff, somebody got to get the mood of the people and determine what the people want.
But
you know, so it's not that I'm anti-politician, but I'm anti the kind of practices that they have that seem to be consistent regardless of the stripe of the politician. You can bet your life they're very predictable as to how they're going to approach governing and governance, right? It's always like this. I don't understand it because they see the pitfalls when they're in opposition, clear as day. But once they get in, there's always some excuse, right? There's always some way to get some work around what really should be happening, you know? And most people, most voters, would put that on the back burner. That's not a bread and butter issue for them.
Put what on the back burner? The fact that they would have seen what was happening before but not seen it now and doing something about it?
Yeah, most voters would say, well, that's politicians for you, right? That's what they do, okay? All politicians lie. All politicians cheat. You know, there's a cynical view that has crept in with most voters, that they don't expect any better from politicians. And so there's no pressure on them to change things.
But you can put checks and balances in place. I have an article here from Elections Canada on political financing. It says, most political entities collect contributions and spend money in their efforts to influence the decisions that Canadians make when participating in the democratic process. Then it says, to support fairness, accountability, and transparency in federal elections, the political financing regime of the Canada Elections Act sets rules on the ways that political entities can raise and spend money. The regime also requires entities to register with Elections Canada and report on their finances annually and or after an electoral event. This financial reporting allows Canadians to see for themselves how money comes into the political system and how it is used. So it's possible to have complete transparency. But yeah,
that's exactly the point. It's not as if you're going to be reinventing the wheel or something like that. There's legislation and so on out there that they can follow. But they're not going to do it because they lack the will. It's like, you know, you're going to take away their hammer if you do that, right? I would like, you know, sometimes I wish I was a journalist and go to some of these question and answer stuff, right? And ask them directly, these kinds of things. What are their thoughts on these kinds of things? Because the journalists don't do it. There's nothing, I don't hear, there's nothing in Parliament like we have question time in the English Parliament where opposition can just get up and ask questions of the government. There doesn't seem to be anything akin to that. And even if there were, you don't get the impression that the opposition interested in it either. It's the same. Well, if I get in, I don't want to be under that kind of scrutiny.
Well, there's a. I mean, listen.
Where
you
does
know,
that leave us?
we've always known there's a kind of tacit, basically, you could call it condoning of all the stuff that they have a hue and cry about that the other party did or the other parties did. There's a kind of tacit acceptance and kind of forgiveness, you could say, because you know they make a hue and cry. Oh, when we get into power, they get into power, and nothing and stuff that would be jailable for regular people doesn't even. I mean, doesn't even result in any kind of accountability. So, and the reason.
Of course, the propaganda part of it, where there are always accusations, but if you look at it, you can accuse, the accused usually come up with things about the accuser, okay? And so they're compromised as well. it's like all of them are compromised, right? The opposition can always point to something untoward that the governing party did, and the governing party would always look back and say, well, you used to do it too. So, and if we don't have, as in our case, we just recycle our partitions to a large extent. We don't have enough renewal where you have new, fresh faces coming in. And so, it's like you fall into the same routine, and even some of the fresh faces just fall into the same routine, right? So it's a hard culture to change, but it can easily be changed if one person gets up and says, let's do this, okay? Because there are examples elsewhere, as you mentioned in Canada, for instance, right? They're part of the Commonwealth. You can easily get legislation and tailor it to suit us, at least come up with something. But as it is, you have nothing.
And there's no
right?
there's no political
all
will
these
for
flights and so on that come in. Those cost hundreds of thousands of dollars.
Listen, when it comes,
and there's no accountability for them.
What we know when it comes to robust checks and balances, that's not something that's going to happen around here. I'm just going to say, and they know it.
Right. I mean, but that's the view of a lot of the voters, that nothing's going to change. It's going to be the same. So don't argue about it. Just play with the game. As long as they get piece of the action, that's fine.
It's been said.
That's the prevailing view.
Well, let me ask you that. Given that, just made me think of something that's the kind of thing that makes people disengage from the voting process. And I've heard it said anecdotally that a lot of people didn't vote at the last elections. You agree with that? What's your sense on that?
Not so much in this particular case, but I get the feeling sometimes that people do not really value their vote. They don't know the value of their vote. Maybe they feel outnumbered or they think they're just a drop in the bucket.
Well, you see,
so
I was told a lot of people didn't vote. A lot of people just didn't vote, and I feel that that's because part of that is because of maybe disgruntlement and the same things that you're talking about. People just telling themselves, "Oh, nothing's going to change." And
cynical now. People are disillusioned when it comes to the whole process.
Even that last election in the U.S., I've heard that said too. That you realize Trump won by a very slim margin.
Of course.
And this was no landslide or anything.
Right. They may claim it. Yeah, even won all the swing states, etc., and claim that it's a landslide. But it was no landslide.
No, it wasn't.
And that's the same thing with a lot of elections around here. There are very few landslides, as in, the opposition get totally wiped out, right? They win, but not by really significant margins, okay? And that's why you would think that even convincing a small segment of independent-minded people that this is the particular way to go, you think that may make a difference. In a close election, it would, okay? But there's always the base, of course, and if your base is big enough, I guess you can push through your agenda, okay? But in a close election, I think the independent people going to make the difference, okay? And that is why it is important to speak out about these things, okay? Because although it might not be a bread and butter issue, it's not a big issue for most people, okay? It might convince a couple of people. People have won elections here by 4 votes, right? So you cannot discount people who are independent and would vote on principle for these things, but it's very difficult to change. Around here, I find it's extremely difficult to change.
Yeah.
And the thing is, it cannot be defended. This current system of money, how money affects politics, cannot be defended. Right? You get into any discussion or debate with any politician about it, he's going to agree with you, but he's not going to make any move towards implementing the change.
Yeah. Okay. We got to take a pause. Okay. We're gonna have we come back over on the other side and continue the discussion. It's 8:39. We're gonna actually there is no weekly dose today, so we decided we'd replay last week's episode, Diagnostic Tools Explained. So we have this coming up right after the commercial break. In the meantime, we're gonna be looking at some other cool stuff for us to talk about when we come back. So we have a replay of last week's weekly dose coming up next.
WINN is 98.9. 98.9 is Win FM.
If you need protection, you need one who you can trust. To secure your investment, you need one who'll do you just. TDC Insurance, you're the one that you can trust. TDC Insurance, you're always safe with us. TDC Insurance is your go-to insurance company for all your insurance needs. We take pride in offering you the best solutions and ensuring our customers are fully satisfied. TDC Insurance, we take good care of you, guaranteeing you peace of mind. You're always safe with us.
Valentine's Day. Visit us at the Koi Building at Airport Road today. Show your love with Jimmy Florals. Shop online at your convenience at stkitsnevisflorist.com. Call us at 766-9189. Place your order now and save big. This Valentine's, shop with Jimmy Florals. We deliver island-wide in St. Kitts and Nevis.
Every day in a busy world, we have to do so much. Bank with CIBC and get that personal touch. Share your ambitions, let us help your dreams come true. At CIBC, you're at the heart of all we do. We're on your side, we're listening, we know the way you feel. CIBC, ambitions made real.
Eight 8:32. It's time for your weekly dose with Dr. Natalie Osborne. Good morning.
As I like to say, daily dose. Good morning. How are you?
I'm doing well. Good morning. I'm having a little bit of a headache, but it's always great to be here.
Always.
Likewise.
Having you, as Jamsta
Alright.
was saying earlier, he hopes no alcohol is involved here
the
today.
discussion.
Yeah, because we were talking about the topic. Yeah.
Just for you,
I
I'll
was just
find a way
kidding.
to weave it in.
I was
because
just
it's
kidding.
very important that we keep talking about it, Jamsta.
Same thing we were saying.
I aim to please. So good morning, everybody. It's great to be here. Hope all of our listening audience are having a beautiful Tuesday morning.
I mean, at the very least, we could have some Irish coffee or something. You know? We have some coffee with Bailey's or
boy.
Kahlua
Wow.
or something. I don't know.
Jamsta would not have you do that and speak like that in this segment. I miss
my God.
Azad. We used to have our tea. Where's our tea this morning?
That used to be me, you know.
That's just a bit. So
Yeah.
this is Azad.
You really think Azad knows how to make tea?
Oh,
But
Lord,
Kortensia-
no. Azad used to come in the tea sometimes when I didn't make
You
tea.
have not
Azad
blessed
burns
me with
water.
your tea.
Tea, I know. I have
He
done it
burns
in a
water.
while.
Are you kidding me?
I won't speak ill of him in his absence. There's too much love between us.
I have to get back on the queue.
Right. Okay. So next week I'm looking for my glass
Tea,
of
yeah.
tea.
I can't let Dominic come here again too, and there's no tea because he'll get me. So as we dive into today's topic, as we said, we were going to talk about diagnosis. So we're for our first question for today: what are diagnostic tests?
So, okay, why this is important? Because oftentimes I see patients in a clinical setting, and for a couple of reasons, sometimes patients are asking for a particular study that may or may not be indicated. Okay, sometimes they're insisting as well, so you have to have that dialogue with the patient to ensure that they understand, because there are hundreds of different diagnostic studies, and you have to know which one is appropriate and indicated in for a particular need. So we're going to discuss a little bit about that today. So first, we got to understand what is a diagnostic test. So thinking of the word diagnostics, you're trying to come to a conclusion what is going on. So you perform a particular test. It could be whether it is blood tests, it can be a series of imaging studies, endoscopic studies, anything that's going to give you a diagnosis or come to a conclusion what is going on. And it could also be biopsies, okay? So you're trying to make a diagnosis or pinpoint exactly what is going on. So that is exactly or essentially what diagnostic test is. But we need to understand, because oftentimes patients would even go to a doctor, ask a doctor, "Doc, I need a whole body scan." I remember particularly being asked that, and I was stopped in the supermarket, what scan can I get to make sure I don't have cancer? Because people are hearing a lot about cancers, but there are hundreds of different types of cancer. What one particular test can give you an answer to that? There is not such. So based on your symptoms, based on the findings, you can then use a particular study to help in concluding, coming to that diagnosis, so then you can have the appropriate treatment. Are you with me so far, Jamsta?
I am.
Okay. So
despite the lack of alcohol, but anyway.
Today we're going to talk about some of the different imaging and different studies that we can use. We're not going to mention all of them, but in our setting for our everyday people, so that they could understand the benefits, indications of some of these studies.
Okay, so what is an X-ray?
So X-ray, so many persons would have gone and get an X-ray. So it's an imaging study. It's a 2D, for those of you who are into that kind of technical science, 3D and 4D. So it's a 2D imaging of a black and white image of that takes pictures of our body, all right? So it is able to look at bones, it is able to look at joints, it is able to look at the lungs, the different areas. You can do an X-ray. That is one of the simplest and the older imaging study tool that we have. And it still has its purpose in today's setting, though we have so much more advanced technology. Sometimes all you need is a basic X-ray, and it's also very cost effective as well too.
And I imagine it probably works best for, like, say, broken bones and stuff like that.
Yes, so that is part of the indication why you need to do this. You're doing it if you want to look at the lungs. For example, you have a patient comes in having chest pain or having cough. You can look at the lung tissue. You can see if there is any lung infection that we call like a pneumonia, a bronchopneumonia. Persons who would have fallen and they have a deformity or bend in the bone, you can look and see if there's a break or fracture, because sometimes people think these words are synonymous when we say that there's a break in the bone or stuff, okay? You can look sometimes at the joints and see if there is any abnormality. When people as people get older, there are changes in your joints that may suggest that you have osteoarthritis. You can do x-rays of the abdomen as well too. There's sometimes a patient would come to you, doc, and say, I haven't stooled for a number of days. And an X-ray is a basic, simple beginning tool that you can look, because what you're looking for is the gas pattern, certain things, the shadows, and the outline of the bowels. It can tell you quite a bit of information. So even in dentistry, you do an X-ray, you see your dentist will say, let's do some X-rays. They want to look at all your teeth and look and see if there's any cavity there. You could do an X-ray of the head. Sometimes, I remember back in the day, not too long ago, we didn't have access to a CT scan, and we would get an X-ray if a person fell. We want to see sometimes if there is a break in the bone. Even in conditions that are non-traumatic, there are changes in the density of the bone. You can see if some persons got different diseases, like if they have metastasis or spread of cancer to the bones, there are changes in that. As a person gets older, there are changes in the density of the bone. So all of these things, and a simple X-ray can give you some information. We know that there is some radiation exposure there, but it's minimal though. Okay?
All right. So let's talk about an X-ray with contrast material.
Yes, that's another study of an X-ray. You may have had some epigastric abdominal pain and your doctor want to look at your stomach. Do you remember they would ask you to swallow that contrast? Okay, you remember that it's a white chalky liquid, and then they'll take a series of X-rays, and then they'll look at your esophagus, they'll look at your stomach, they can look at your intestine, and it gave us a lot of information. Oftentimes, though, some of these studies are not the first go-to and not the gold standard because we have advanced in technology and we have more precise studies, but there are indications still where we can use them. You must have heard of something that is called a barium enema, where you inject a contrast via the rectum. Yes, and you can take images and look at the colon as well too. Okay. So especially before the advance in things like colonoscopy, we would have done this barium enema much more frequently. And you could have seen if there was a blockage at time, you could see if there was an outline of a tumor or cancer. But a lot of these tests have been replaced by more sophisticated studies like the CT scan and like a colonoscopy in terms of diagnosing.
So, but when the barium is given by mouth, that's what they call the barium meal, right?
Yes,
okay.
The barium meal. Yes, that's so true. So you swallow that, and they took a series of images to see how it would pass through as it goes down to your food pipe or the esophagus, and it goes into the stomach, and you see different changes in the lining. You can see the outline or the shape of the stomach, and it gave you some sort of indication. If, for example, the outlet from the stomach was blocked, you'll see that the contrast doesn't pass through. All right. So these studies had the indications.
So let's move on to diagnostics for the breast, the mammogram.
Yes, so you know that a mammogram is an X-ray. Yes, it's a special type of X-ray, so it's an X-ray of the breast now. And we know how important that is. So the mammogram now, we use it for screening. We said women get their mammogram yearly. Or every other year based on the recommendation with their physician, or you can do it if you have signs or symptoms. For example, if a woman comes with a lump and she's above the age of 40 and she's never had a mammogram, you want to do a mammogram. You want to see if there's any microcalcification changes. It can give you lots of other details that you may not get by simply examining the breast. Sometimes you can detect early changes in one or the other breast, okay? So usually we use it for diagnosis if you would have seen the patient have recurrent breast pain or some symptom that may be important at that point to get that image done.
And let's move on to ultrasound. Another very popular diagnostic tool.
Very popular. So to talk about what an ultrasound is, so it's a diagnostic tool, but in this case you use sound waves. You're not using ionizing radiation, so there's no radiation involved here. So you use what we call a transducer, and it says high frequency sound waves, all right? They're inaudible to the human ear, and it records these images. So it's quite simple, and it's quite cost effective. It's not as advanced or not as costly as things like a CT scan or MRI, and it can help so much. It is easily accessible to most of our people, and it sees a lot about the soft tissues. You can do an ultrasound, for example, of the breasts. If you have pain in the tummy, one of the first go-to tests is to do an ultrasound. You may be thinking, if I have pain up on the right upper side, do I want to look at the liver? All depends on what the symptoms that the individual have. The doctor can indicate an ultrasound.
Quick question. That thing that the doctors, that gynecologists do when a woman is pregnant, that's X-ray, right?
No,
where
that's
they
an
put
ultrasound.
Oh, that's an ultrasound. Oh, I wasn't
yes.
sure.
So
where they put that gel on the stomach.
That's exactly what we're talking about. So that is one of the indications for doing an ultrasound. So they put you on the bed, they put that gel there on the tummy, and what they use is that little instrument that's called a transducer, and they pass it over, and it's looking at what's going on. So early in pregnancy, it will confirm that there is a fetus there. It will confirm if it is viable or it's alive, and as the fetus develop, it will look at the different parts, and it can also help in terms of estimating the time of gestation, how long you've been pregnant, and give an estimated time of delivery. So all that is extremely important. So that's what an ultrasound does.
Okay. So what are the indications of an ultrasound?
Just as we said, if you have anything like any abdominal pain, you suspect a pregnancy, all right? You want to look at the liver, the gallbladder, the spleen, pancreas. If someone was involved in a motor vehicle accident, oftentimes when they come to the emergency room and they complain of abdominal pain, that is one of our go-to, because you're ruling out if there is any free blood in the abdomen that shouldn't be there. So that's an important indication. You want to, a woman comes in, oftentimes it's a very important go-to test. You have a young 25-year-old female Jamsta, and she's in a fertile year, she's in a prime of sexual activity, etc. And you're suspecting that she may have acute appendicitis. You can do an ultrasound there, because you may think, is it really acute appendicitis? Does she have an ovarian cyst? Could she have a pregnancy? Could it even be an ectopic pregnancy? So an ultrasound is extremely important, and it solves a lot of the day-to-day medical issues. It may not be able to solve everything, okay, because some details it may not be able to give us. But it's a very important initial study, so oftentimes. There are times, though, because sometimes you may have a patient or two who comes to you and they're insisting that they need an ultrasound, for example, and it's a quite obvious diagnosis, like you have an abscess, which is a soft tissue swelling with collection, and you say, I don't think you need, because clinically we can make that diagnosis.
Swelling with collection, what's that?
That's an abscess, like you have a pocket filled with pus.
Wow. Okay.
So the person may come in with a swelling in their back, on their arm or whatever, and it's warm, it's red, it's tender, and it's painful. But clinically, you can say, okay, this is an abscess. In this instance, you may not need an ultrasound.
Okay.
All right.
So what are the benefits of an ultrasound?
As we said, it's easy accessible, all right? You're not exposed to any radiation. It can be done quite easily by any radiographer or radiologist in their office, okay? And it gives you a lot of answers immediately. It is not as expensive as some of the other tests that we can talk about, like a CT scan or an MRI, and you can get a quick diagnosis at that point there.
Okay.
It may not give you all of the information, because remember, Kortensia, sometimes we're doing studies not just to get an answer, but to eliminate other potential catastrophic conditions, okay?
Okay.
Okay. Let's talk about scans. So we're going to start firstly with the city. So tell us about that.
So the city, everybody would have heard about a city. It's made so much news in it. Are we going to get a city at the hospital? Do we get, what we're going to do? So I remember though, I've been here long enough to know before we had a CT scan. A lot of time, individuals were coming from a motor vehicle accident, and because we had no access to a scan, we may have done a simple X-ray, but we always admitted them just to keep them close by for observation. But now with the advent of a CT, which is called a computed tomography or CAT scan, you would have heard some of these words being thrown around. So it's like a advanced X-ray. So you're taking multiple series of X-rays as the machine, because it's a big machine, and you're being pushed to it, and you're taking a whole series of these X-rays, okay? And you're seeing on the inside and taking more detailed information of your organs. So it's pretty impressive, the stuff you can get and the information you can get from these CT scans.
Tell us about the things that the CT scan can detect.
It can detect a lot of stuff similar to an ultrasound, but give you much more detail as well too. If you have a fracture, if you have something wrong with the heart, it could look at the structure of the heart. It can look at your bowels. If you have kidney stones, Jamsta, it can see the kidney quite beautifully. If somebody was involved in a motor vehicle accident, it can see if there's a bleed inside of the brain. If someone had a stroke, you can see the areas where there are changes inside of the brain parenchyma, the brain matter, and you can identify the area where the abnormality is. If the person had any kind of internal bleeding, another go-to one is after the ultrasound, and you can get a CT scan to give you a little bit more detail, to be a little bit more precise which organ is affected. You can have a CT scan done.
Okay. I see. For
So the main difference with that now are the ultrasound is important. That is going to be a little bit more expensive, your CT scan, than an ultrasound. It takes a little bit more time to do it. The benefit is going to give you more detail than the ultrasound. The images are much clearer. Because you see, when you see an ultrasound, you see all these black and white dots, and it's so much more complex, and it takes somebody who's trained at looking at these studies. So a CT scan is much more easier to read. You can see broken bones. You can see a whole series of things that can help you. You look at the lungs. You can pick up if there is a lesion or tumor inside of the lung. So very, very beneficial.
Okay. And of course, we're going to now move on to MRIs. But I want to ask you a quick question. Nowadays in radiology, would a radiologist have to learn to do all of these tests, or would it just be X-ray? How does it work?
The radiologist is trained in
doing all of those.
All of these tests.
Okay, I always wondered. Yeah.
In most of first world countries, of course, part of your training, you're going to go through a series of these rotation where you're trained to use all
of them. Okay.
You have the technician who usually perform the studies, and the radiologist, which is a doctor specialized in radiology. That individual will then interpret the study. So you would have heard of a radiographer.
Yes.
That's the technician part of it, and the radiologist is more doing the interpreting, using the science and medicine, because they're a doctor.
Okay.
So they use their understanding of clinicals and combine it with the images that they're seeing. Okay. So it's not just isolated, Jamsta. So when we send a patient for any study, whether it be an ultrasound, whether it be even an X-ray, whether it be a CT scan, you have to send clinical information to guide your radiologist. What are you looking for?
Okay.
If my area
context,
put it in context. If I'm concerned about the liver because the patient is having pain up in the right upper side, if you have the patient is having vomits, if the patient is turning jaundice or yellow, so you want them to focus on a particular area.
Okay, so MRIs.
So MRIs, that's been a hot topic as well too.
Yes, for most people.
Yes, the MRI. It's kind of scary because you're going, and it could be, a person can be claustrophobic and very uncomfortable in something like that. So it's a non-invasive imaging technology study. So it uses strong magnetic field and radio waves. So it's a little bit different. It's not using ionizing radiation. So it uses radio waves. A lot of those details that we may not understand, that's more of the technical side. So it is used as a layer above the CT scan. Why is that? It gives you a little bit more detail, especially if you're looking at things like ligaments and joints. If you're looking at the spinal cord, you can see more detail. If a person has something with the herniated disc, that is that area between each vertebra, the person is so much more detailed. All right. It takes a little bit more time to do, Jamsta. It's not your go-to in an emergency setting. You have to be precautious in patients who would have any kind of magnetic, like a foreign body, person who have a bullet. Yes. Persons who may have a pacemaker. You have to be cognizant of that. Persons who have metal plates and stuff, those patients. So yes, you have specific indication so it doesn't create any harm when using it. But the same way as anything, Jamsta, it can be used to study similar organs and structures such as like the CT scan.
Let's talk about differences. So an MRI differs from a CT scan and X-ray. So could you explain the difference between the three?
So the MRI is thought to be a little bit more superior. You get much more detailed images than what you can get a CT scan. You want to be more specific. It is very detailed and very good at looking at certain joints, looking at the details of ligaments. In the spinal cord, you get more detail from an MRI, okay? Looking at if there is any injury to any of the bones here that we call the vertebra, if there's the spacing has changed between each vertebra, if there's any compression, so all that details you can get much more with an MRI. It's going to be more costly, so that's going to be a little bit more of the drawback. Because every segment of the body that you do, yet again, it comes back to my concern where a person will come and say, Doc, I need a whole body scan. There's no thing, because you can do an MRI of the head, you can do an MRI of the abdomen. And please note, the abdomen is separate and different to the pelvic. So if you want an MRI of the abdomen, it only stops, I think, just below the navel. And then of the pelvic, you go further down. So these are two separate studies. You can do an MRI of the heart too and get lots of beautiful details of the brain.
How do you do that kind of localization though? I mean, do you still go down into the tube and...
Yeah, and of course they would know where to cut off in terms of your specific areas.
Okay.
Like if you do an MRI of your chest, you may just get, in some of the images, you may just get a little bit of the upper part of the tummy or the abdomen, but they're going to focus on the chest because that is what you requested.
Okay.
So each study is very particular. Some persons that are drawback are claustrophobic. You may have to sedate some of these patients, and it makes a lot of noise sometimes. You need a headset. You want to, it kind of gives you a sense persons get really uncomfortable, okay?
Quick question, the CT scan and the MRI, do they both have that tube that you have to be...
Yeah, a similar tube like that you have
but
to
the
go
CT
through.
is more open, isn't it? The CT is more open.
Yes, a little bit more open. But it's that big round machine.
Thing. Yeah, I know the big, but it's more open than the MRI that's like closed, and most people say that MRIs make them feel like they're in a coffin. Because you have to lie straight.
Hence yes, and you can't do too much movement. Hence the sense that persons are being claustrophobic if you're uncomfortable in tight spaces.
Well, this is a good time to break down the differences between the CT scan and the MRI.
Yes, so we talk about some of the differences. The CT scan use ionizing radiation. The MRI is waves. Okay, so that's a different. It's more cost effective, the CT scan. It is easier to do. You have to plan more to do an MRI, okay? Particular conditions. Not everybody can do an MRI because we spoke about persons who have foreign body that are metal, like objects, pacemakers. You have to be quite aware of that, okay? Both of them, most of the risks are very limited in terms of using these studies, but they're very beneficial. So if you're in an emergency setting and you're thinking that a person was involved in a motor vehicle accident, and a CT scan would much more accessible to get a quick look at the abdomen, seeing if there's any injury to the liver, injury to the spleen. You're not going to go to an MRI like that. An MRI would require that your patient is much more stable. So that should give you some ideas. MRI is going to be much more costly. Remember, these are diagnostic tests, because sometimes a patient do come to the clinic and they will say, Doc, I need a study, but I have to remind them the study is just giving us information. We're still going to have to treat based on the information that we have, so that they do not think that this study cures it all. It just gives us information.
Okay, let's talk about a biopsy. And why is it done?
Okay, so a biopsy is another form of diagnostic study. It's almost a gold standard in a lot of things, like when we're talking about cancers. Any type of disease you want to confirm, you want to take a sample of the tissue from wherever this the organ of concern. There are multiple types of ways. You could take it via a needle, small samples. So it's very beneficial in terms of giving you definitive diagnosis, because a lot of these other things can give you presumptive. Like, for example, you suspect that there's a lesion in the liver. But before you can put a definitive diagnosis or tap on it, a stamp on that, you're going to need some form of biopsy, and especially if you want the person to go on and have chemo radiation therapy, because your oncologists have to be certain that we're treating and what type of lesion or cancer we're treating. So that's why a biopsy is very important. And we can also, important to mention, we can also use an ultrasound to help us guide when we're doing a biopsy. That's important. You may see us call the radiologist to come in while we're doing, or somebody who's versed. You can use the probe and help guide you if you're doing a biopsy via transabdominal. So you're sticking a needle in to get samples from a particular organ. You could even do it guided by a CT scan as well.
So, what is this surgical biopsy? Sorry, Jamsta.
Surgical biopsy, we have needle biopsy, aspiration biopsy. Surgical biopsy means just cutting into the tissue and taking a sample. There are different main types of biopsies. You could have an incisional biopsy where you just take a piece of the tissue, or excisional. If you have a lump there, a mass, a tumor, you take the entire thing. All right? So there are different forms of biopsies. Jamsta, you were going to ask a question.
No, just thinking about needles and.
Oh, you don't like needles?
No.
Those are the least of your problems.
Needles, yeah. It's typically the male patients who give much more. To get them in to get their medical
jokes
checks.
were nice on the gentlemen.
Makes a line. There's this line from a Sting song in my head now. If blood will flow and flesh and steel are one.
Jam said no, not at all. Okay, endoscopy. We hear you talk about this all the time, but it wouldn't hurt to remind the folks.
So in terms of being a part of the diagnostic tool, we know that an endoscopy is important. You remember earlier we spoke about contrast studies when we did a lot of these barium meals or the barium enema, where you had to swallow that disgusting white barium. Now that has been mostly put to the side. It's not completely obsolete because there are indications where it can help and come in as a backup. But now the gold standard would be to use endoscopy. So you use a small camera, flexible tube with a camera at the end, and you're looking down and you're taking images, and you can take biopsy there to help confirm and make your diagnosis.
I'm assuming this would be a cost-effective option, if maybe to save money.
As compared to, because
like MRIs or CT scan, probably.
Okay, but here's what. That's why I said everything goes hand in hand. Because if you were to do a CT scan, for example, and your doctor saw something abnormal in the stomach, think about it like that. Then you would then go in with your endoscopy to confirm what the images show, because you get direct pictures. And then if there is something, you can take biopsy of that. So you see how that can be of help. So here's what we are trying to show the audience, that these tools work hand in hand and they can be complementary. But ultimately, especially if you're dealing with a serious diagnosis of a cancer, you're always going to want some form of tissue diagnosis in most instances. And that's where your endoscopy can see the lesion directly, take a sample. We've got things, we've talked about them before, bronchoscopy, colonoscopy, that's going to the anus. You've got studies, arthroscopy, where you're going to the knee joint and the knee space, and you're looking and seeing different things. You have a cystoscopy where you go through the urethra, get into the bladder, and you're looking and seeing, and if you see anything abnormal, you can take samples as well.
Stop.
Yes.
Look at this long word right here. Oh my gosh.
The EGD, just say EGD. You remember we've talked about that. That's the upper endoscopy. When you hear EGD, you're talking about the esophagus, the stomach, which is the G, and the D is the duodenum, where we look at the first and second part of the intestines. Okay, and then the colonoscopy comes up from the anus area and see the colon and help to make a diagnosis. So these tools are very important in helping. Go ahead, John.
Burl has a good question. He says, when you have a biopsy and you take a piece of the organ, does that part of the organ grow back?
Well, okay, I like that question. Interesting enough. But if you're taking a sample, most of the times it's a small sample, you know. Yes. So that space is then later occupied. For example, if a woman takes a biopsy or even take a partial excision of a breast, that space later fills right up almost as if nothing was removed there.
Oh, okay.
Yes.
Okay.
The body is a beautiful way of repairing and regenerating itself. And most of the times the biopsy samples are small, okay? So you don't even miss just a few cells or millimeters or centimeter of the tissue.
So which systems do we have at our hospital?
Oh, with Sister, I am so proud. I'm proud to say that. Well, we have our x-rays, so we know that we can do those. We can do our ultrasounds. We can do our CT scans. We can do our endoscopies. We have hysteroscopy, upper and lower endoscopy, arthroscopy. So I'm proud. And we have MRI too. Yep, we're not at the hospital quite as yet, but we know we
is
have.
That what they're building? Is that what they're building up on the northern part of the grounds?
What?
I know they're building a building.
You mean at the hospital?
Yeah.
So yes, eventually we have that. But one of the radiologists, she's invested in MRI, Dr. Clark Byers. So that's good. And I think we still have that on down by the Boreal as well too. So I am proud. We're thinking overall for our people and for our country, irrespective of who has these machines. Once it's accessible, and all of these comes in to help. Because think about where we came from.
Yeah, my mom had to go to Antigua to get both a CT and an MRI.
And you don't have to do that for most parts anymore. So we've come a long way. And we have a long way to go, but we're making so much stride in our health care. We're making so much stride.
Think the X-ray will ever be obsolete now that we're making so many technological
I like that
advancements?
Question. And it's unfair to throw away the old. Yes. That's a very good question. But in terms of obsolete, in some first world country, they use it less and less and less, but it still has its benefits. So I would never throw it out of the door, because if a young man falls down and you see he comes in and he has a deformity, what you gonna do? You need an X-ray immediately. Bam, you have that he has a fracture. You can identify what type of fracture it is. Okay, is it complete? Is it incomplete? The part of the bone that is fractured. Absolutely. So it still has a lot of use. But that's an excellent question. In first world countries, a lot of times they go to the more sophisticated study. Doesn't mean that the basic study doesn't give you any information, because it does. Okay? And then as a physician that's not specialized in radiology, you may not be able to read and get all the information from maybe a CT scan or MRI on your own. Sometimes I love to look at my x-rays. This is an example. If a young man comes in, he's stabbed in the chest, immediately I could see that if his lung is collapsed, I don't need a CT scan for that. Immediately we can address the issue. So an x-ray still has a lot of use. Okay?
Yeah, seems so. So the tech has to know how to use all of those things.
Yes, so our radiographers, we have quite a few at the institution, so they perform these studies. And of course, they're educated in the angle which you need. They can advise the physician which is the best angle, which is the best type of imagery that can help you to make a conclusion.
Very interesting.
Yeah. So remember, people like to think, and sometimes a patient comes into the office, and I like to remind them, this is not done in isolation. Is a whole team that's working to make sure that you get through. I know a lot of times the doctor gets most of the credit, though a lot of times they get a lot of the downfall too, because whom much is given, much is expected, but there's a whole team surrounding us, helping us to get through and helping it to make the patient's care the best.
We really don't give everybody their flowers.
Yeah, so we need to celebrate and spread it out. That we have great teams around us. The nurses who work hard constantly, keeping you up to date. You have the persons who transport the patients to the operating room. The persons who are responsible for maintenance and keeping the institution tidy and stuff. So these persons do need their commendation.
Everybody plays a role.
Yeah, everybody plays a role. So the question is, what role do you play? And we got to remember to be kind to each other. So Jamsta, anything else?
No, this is a pretty interesting show, actually. I was thinking at the beginning, I said, this is an interesting approach for a topic.
So people would know, as you said, they wouldn't just run in the office and say, I need a whole body scan.
Yes.
They understand now.
And sometimes our thing, which the ultrasound, I do give credit, it can give you a lot. If they don't feel like they get an ultrasound, they don't feel you've done your job or something.
Oh, really?
Yes, there's some persons. You've got a mixture of patients that we see, so it's always so beautiful to see the difference. I see patients all the time. I say, but everything is well. You don't need to come back in. Doc, I'm coming back next week. Or the person who needs to come in and they refuse to. So you do have a mixture of personalities.
And I'm sure you have the cases where just the laying on of hands. Like I've been to doctors where they would maybe, oh, okay, that's so and so. You know what I mean?
Yeah.
I mean, I guess you would have cases where things are pretty cut and dry.
I think what you're saying is that a lot of time people just need reassurance as well too.
Yeah.
I saw an individual just yesterday. He had a lump on his shoulder, and I remember seeing him some months ago where he had a skin lesion, a skin cancer. But he came back and he had a lump. I said, no, that's just a cyst. You can remove it, but it's not anything scary. And a lot of time, persons just need reassurance too. So the doctor is not only working as a physician, you're a counselor, your support system. And a lot of time, once you tell the patient everything is going to be fine, and you're they can relax and feel much better. So
I have one question to ask before we go. Can any of these scans be harmful to somebody that's pregnant that may need, let's for instance go to the CT scan or the MRI? I'm going to use those two. If you're pregnant but one of those scans are necessary, can you still do them or you cannot?
We don't typically use any of these scanning pregnant women. Most times you can use the ultrasound. Okay. It's very rare you're going to need more than that, because here's what. The ultrasound, and they have so much 3D ultrasound and all these advancements. They can they can see the fetus in all different directions and all the dimensions. So you can diagnose any abnormalities, any deformation. Okay, so very rarely you may ever need to do anything like that. But I want to keep in mind, usually though, in medical practice, we were taught that to prioritize the mother first, because if the mother is not healthy and well, the baby will not be likely. But most times the ultrasound would give you the necessary information by someone who's well trained to identify all the different changes as the pregnancy progresses. Okay. All right?
Sounds good.
All right. It's always a pleasure.
Yes, the pleasure is ours as well. Another episode of Weekly Dose, and she's going to be back next week with more interesting stuff to share with our listeners.
Yes.
Okay.
Have a great day, everyone.
Day.
Be blessed.
Thank you, Doc. You too.
Unlock the secrets to a healthier you. Join Dr. Natalie Osborne every Tuesday at 8:30 a.m. on WinFM 98.9 for Weekly Dose. During this 30-minute health discussion, we aim to educate and empower our listeners on the prevention of diseases, early diagnosis, and timely intervention. Don't miss out on this informative health talk where we teach you to live your best life. Weekly Dose, Tuesdays on WinFM 98.9.
Do you want to know what's happening in sport? Tune in to On The Ball, a weekly tour show which is on WinFM 98.9 every Tuesday from 7 to 9 p.m. with me, your host, Troy Biff Mills. We will keep you on the ball with our variety of guests and, of course, your calls, discussing the facts and the stats and sharing your opinions. Get on the ball and stay on the ball by tuning into On The Ball with Troy Biff Mills on WinFM 98.9 every Tuesday night from 7 to 9 p.m. and also on Facebook and YouTube. Be on the ball.
We're different. We're 98.9. 98.9 Win FM.
Okay, that's a repeat of last week's Weekly Dose. It's 9:21. Let's take a quick break and come back. And we get into it. Island Tea returns.
It's the sale you've been waiting for. Happening now. Discounts galore at your favorite Hosford store. Hosford's Furniture and Appliances, Ashley's Furniture Home Store, Hosford's Building and Nevis Centers, and Hosford's Auto Parts and Accessories. Get ready for discounts galore. Store discounts, big discounts, small discounts, VAT discounts, and more. We're slashing prices with at least 4% VAT off and up to 20% off store-wide on furniture, appliances, auto parts, building materials, and hardware, and so much more. Discounts galore across all Hosford stores. And that's not all. Customer discounts and even Value Club member savings mean the deals just keep getting better. Whether you're upgrading your home, tackling your next project, or fixing your ride, Hosford's has you covered. Take advantage of the discounts galore at all Hosford stores today. At Hosford's Furniture and Appliances, Ashley's Furniture Home Store, Hosford's Building and Neva Centers, and Hosford's Auto Parts and Accessories. Hurry in! These offers won't last long. Don't miss out on the biggest savings of the year. Visit any Hosford store now and start saving with discounts galore in every store. Big deals, big savings, and more. Terms and conditions apply.
Valentine's Day. Visit us at the Koi Building at Airport Road today. Show your love with Jimmy Florals. Shop online at your convenience at stkitsnevisflorist.com. Call us at 766-9189. Place your order now and save big. This Valentine's, shop with Jimmy Florals. We deliver island wide in St. Kitts and Nevis.
And we are back. The good doctor couldn't make it today, so we had a repeat of last week's weekly dose on diagnostic tools. And she basically explained all those diagnostic systems that doctors have at their disposal. So we are back. And we had a question. We had an interesting question in the chat during weekly dose, and we decided we were gonna bring an answer to. You wanna go ahead, Kay?
Yeah, one question. So the commenter asks if we knew, let me use the past tense, what the X in X-ray means. And it says, we found an article that says, where does the X in X-ray come from? It says, the answer is that a German physicist, Wilhelm Röntgen, discovered a form of radiation in 1895. He called it X radiation because he didn't know what it was. Yes, it's as simple as that. This mysterious radiation had the ability to pass through many materials that observe visible light. X-rays also have the ability to knock electrons loose from atoms.
Yeah. Hang on, caller. Yeah.
So over the years, these exceptional properties have made X-rays useful in many fields. Go ahead, caller.
We are taking, so go on with your finish.
Yeah, you go ahead.
Go ahead. What's up?
Okay. Give thanks. All the things up, but all the things down too. What topic on the table?
Nothing really. We just had a rebroadcast of last week's weekly dose. We were just trying to fill in a question that came in while we were replaying that on what the X in X-ray stood for. Well, you can talk about anything. Go ahead.
Okay. All right. Give thanks. We're in a brand new month, February. They call it Black Story Month. So I hope it helps to raise our consciousness as a race of people. We don't hate nobody. The human race is what it is. It was, the creation of the Most High. But it's important to have a full knowledge of oneself and one race, and within the scheme of things. So all other races do that, and hold on to what them hold on upon. So it is important for we to do that also as a people. And we're not just ordinary people, It is said that we are the original people. Originate in a place that is the cradle of civilization. So, we are great people. And we need to embrace that greatness and more.
What do you...
Okay, and we want to wish all who celebrating Black Story Month all the best, Conscious one. All right. Public Works Department. When I was working with Public Works Department in my young age, Mr. Berry was in charge, and, he used to do things in a kind of way. That's why we keep saying, it's important to have the right places in the right places. Right now they're fixing College Street, got the little iron thing in the middle there where the water has come through, where people fill up a garbage almost every day. It had a 2 minutes in front of the new Chinese supermarket, one in front of my gate too. I hope they come down to it. So them fix it and them bar up the water flow with dust. And all the dust now come down where the stoplight there in College Street got. And there's no one, you mean to say there's no one to monitor. We notice a lot of government workers, them work nasty. They cut grass, they garden the drain. You know, a whole heap of things we observe with workers. Them they work clean. They have to leave a trace. Things incomplete. So we are called upon Public Works Department to come clear up the drain where the dust bring down by the stoplight. And while we depend on that, we want to add, maintenance is a problem with us, maintenance and upkeeping of things. There's some railings on both sides of College Street, got right there by the stoplight to assist elderly when they're walking up or down to hold on. And the ones on the left-hand side by the church, it get disconnected and was on the ground for weeks. People just pass it and it be a lean up and sometimes it drop down. Until I decided to take it up. So I took it up and secured it. Mrs. Mary, but another mother, reminded me the other day she come in going to church and she said, she's holding up on Mr. Morton House because the railing is on that side, is not there. And it reminded me that I secured that railing and I'm calling on whom it may concern, the minister. Who's the minister of them things here? The brethren from Monkey there.
You mean Public Works?
But the minister of road and
Congress Maynard.
I'm calling on Mr. Maynard. If anyone hearing, please pass on the message. I will do so when I meet him next. To replace that, I have it in my possession. Replace that hand railing that helps elders and when they're going up that they can hold on to. Yeah. And to look around. We observe it in almost all of the ministries. There's no feel. They don't have the street vibes, street knowledge of the way things is on the ground. Street. We observe it in the nastiness. We see solid waste still I say waste matters. And the nastiness just, it's like they're encouraging the nastiness. Because waste don't matter. And waste is all over in the alleys, in the this, in the that, garbage. And all they're doing is cleaning up after. They won't even decide, say. They call him on the other rebel payment now. Implement policies. Prince, implement policies and taxes. People pocket. They drop a sweetie paper, we charge you $1,000. And if you feel like you can keep paying it, we send you to prison. Until your meditation change with your nastiness. Yeah? We need to stop cleaning up after nasty people. We are wasting energy, time, money, we're wasting everything. Cleaning up after nasty people. In my whole life, it's one time I see a tourist litter and I drive in front of the vehicle. Stop my bicycle and tell the driver, look, no find out to throw that out there down by the fort. And make them come pick it up. It's mostly people who say they're skitishans and I notice them who come from the places them in the Caribbean, they're following them to follow suit. Especially the Spanish people, them, they're nasty. You have some live here in College Street, God, they move, 2 sets. And the garbage still here under the move. Yeah. We told we brethren there, Bongo Bedania, at Parks and Beaches. Parks and Beaches way ahead of solid waste. Solid waste will shut down. And Parks and Beaches take over. It's just too many irresponsible flexing going on from them time till this time, as though the environment don't matter. We're calling upon the honorable lady there, who we know as a baby, Lady Clark. Just met your mom the other day, and she reminded me of my connection with you all when you was a baby. Your father's a Rasta man, you know. Now watch him head, you know. Theo Clark is a Rasta man. Yeah? So that royal stock you come from, so let you work. I call upon the Honorable PM to give her the clout. What she need to make Sinkits and Nevis be clean. We say be a land of beauty. The nastiness is marring the beauty. I think we have said enough. Blessed love.
Okay.
Thank you for your contribution.
All right, cool. Yeah. Always crusading against the the nastiness. Yeah. Yeah, he ain't saying nothing wrong.
No, and that's correct. Because we can't say a land of beauty and we keep it dirty. That don't make sense.
Exactly.
Then we definitely have to change those words.
Exactly.
And then the words that we put in there won't be nice. But that's a... Okay.
Finish your thought, then we go to the break.
I was getting back to the stairs because I often wondered where were the handles. And when I really see, as he mentioned, elderly persons struggling up there, I feel for them because I don't want them to fall backwards. Because just imagine somebody falling backwards or into the road, into traffic. So please, to the powers that be, please replace those hand railings. Please. All of us are going to get there one day, and we want to be safe as well. So let's ensure that for the elders that built up society thus far, let's take care of them as much as we can.
Well said. Okay, let's take a break. Hear from Rams. 9:34.
We're different. We're 98.9. 98.9. Win FM.
Drink coffee. Reduce sugar chubby with the same great taste. Lots of magic fruity flavors. Drink the more healthy way. It tastes so yummy, chubby, chubby. 25% less sugar chubby. Be active, be healthy. Drink lots of chubby. Kicking football, playing cricket, having fun in the sun. It's chubby. Reduced sugar chubby keeps you cool and refreshed. It tastes so yummy, chubby, chubby. 25% less sugar chubby. Jumping rope, running races, have fun. It tastes so yummy, chubby. Drink the more healthy way.
We are back. It's 9:36, and you're in full flight before I rudely interrupted you.
Oh no! I was like, what is he saying to me now? But I got you. Don't worry. Worry. We got each other's back.
Okay. So yeah. Also, folks, just reminding you that next week, Wednesday, the National AIDS Secretariat will be here. I actually had them on Dr. Offrey and one of his colleagues. They were on yesterday on Voices.
So that's next Wednesday?
Yeah.
Okay. And
but no, they're going to be on Island Tea because the February 12th is the International Day of condom. Was it condom awareness? Some kind of condom awareness. So they're going to be on February 12th. So that would be next week Wednesday, in the place of Nutrition Nation. Yeah, so they're gonna be using that spot next week, 8:30. Yeah.
Okay, and tomorrow, Wednesday. Yeah, I have to say tomorrow, Wednesday. So tomorrow is Wednesday. We will be having the High Commissioner Designate of Canada, Brenda Wills, on the show. So you have to stay tuned for that interview tomorrow.
Okay. What time is that again? Let them know.
I think it's at 9. Hold on one second. I didn't put the time next to it.
Yeah, so I guess she's gonna be you could say sort of presenting her credentials to the government and everything.
Yeah.
And she's gonna stop by. She's probably gonna get some. I imagine she may get. Maybe we should think about some questions we want to ask her. Yeah, I'm already formulating some questions I want to ask, but okay.
Yeah, we got plenty.
Yeah.
But you can formulate other ones. Yeah.
Okay.
I'm coming.
Yeah. So you want to take a look at that thing. Someone was asking about some electricity payment system that's going to be. I wonder if it's that the system that they use. I heard they use it in Dominica where you can pay for electricity sort of the same way you do
top up.
Yeah, prepaid phone service.
It happens in Ghana too. You pay for a certain amount, and when it runs out, you go and you pay for more. It's like, yeah.
Why would anyone? Okay, all right. I mean, okay. I was just wondering, like, what's the word? What's practical about that? That seems like a strange thing, a strange service. Because for electricity. Because say you're doing something and it just runs out. I mean, inconvenience it is when your phone runs out of credit.
I just have
when you have a prepaid phone.
Yeah, but won't you be monitoring though? Won't you be monitoring what you use, your units?
I guess. It just seems. I'm just wondering why that would be needed here. I could understand Dominica where it's rugged and. Okay, I guess maybe people don't have as much. I'm assuming it has to do with people maybe not having as much disposable income and whatever. I'd just like to know. Well, I would really like to know what the reason is for having that kind of electricity service choice in any territory. When I found out that I was like, really? It seems like I think they do it in Jamaica too. I'm not sure.
Yeah, I think a lot of the big places. I can research the countries, but I know they do it. I heard them say they do it in Ghana. I know they do it there for sure. So you pay for what you use. But I see an article here that's saying, why pay up front for what you're going to anticipate?
Yeah, because something could, because something can.
Go
wrong? You mean they're saying are they?
Okay, let me say the exact words. Okay, so it says, some 6 years ago, I stood on the sidewalk in front of what is now the Cable Building. As a march approached, I vividly recall the procession, although I was childishly ignorant of the circumstance that precipitated it. We won't pay for floor space, we'll pay for what we burn. The illuminating words spoke for themselves. This was a landmark in the history of the PAM party and the beginning of a significant opposition on the island of St. Kitts. Let me go here. I recently listened briefly to a clip of the Honorable Minister responsible for utilities as he outlined the introduction of meters which would force consumers to pay in advance for a top-up in order to get electricity in their homes. Seemingly in response to a colleague, he said, "This is a top-up country," to which he drew a laugh from his colleagues. To me, this is no laughing matter. It means instead of paying for what you have burned, you must now pay up front for what you anticipate you will burn.
Okay, so I guess maybe it's a move to boost
help?
Maybe to boost income.
To boost income, how?
Well, because if you're paying up front,
What if you don't use all of that? Does it roll over?
I would think so. That would make sense.
Okay.
And I imagine some people will re-up even before the money is finished. But
Yeah, because we won't be paying attention to the units for those who will have that.
This is interesting.
Because it goes on to say, what if there is some unforeseen event or miscalculation? Your allotment ran out when your children are in the midst of homework, as you rightfully say, and you have no money at the time to top up.
That seems like an anxiety-inducing, system to me.
It also says, I know it's an effort to avoid arrears, but if you are on minimum wage or out of work, sometimes you do have to prioritize for food and medicine and maybe pay piecemeal. A top-up system for the poor could be a terrible burden in my view. And these are the words of Dr. Talma Brown. There's the article reads, it's from Caribbean Times. It says, a call for sober reflection on top-up electricity system and national priorities.
Okay, let's take a caller. Caller, go right ahead. It's 9:43. Caller, go ahead.
Yeah, good morning. Good morning, man. Good morning to you guys.
Morning.
Yeah, so Jamsta, this new thing what they're talking about with this prepaying for electricity, is this already, is it already a
No. Let's not go there. No, it hasn't yet. It's just that something that's being discussed.
Something that's being discussed.
No.
Okay, so the education part of this got to come up. Got to be, discussed with the people. Me personally, I don't think the people is ready for anything like this. The education got to come about first.
Well,
we're not going to talk to people about this stuff.
Well, my friend just put just gave me some food for thought, because she's saying the key is that consumers must be able to choose, and yeah, I agree. It's another choice. Some people might find it a better electricity supply regime for them. Others will just continue with what we've always had. So I take the point. She was also telling me in the UK they have a top-up heating service. Yeah, now that she mentions it, yeah, I remember that they, a top-up heating service, but it's an option. Customers still have a choice to pay monthly, as is the case with cell phone service. Yeah, so yeah, I take the point.
So they pay. So if they run out in the UK, they have a way to pay right away, because I'm hoping that if that system is implemented here, that if the person runs out, as this article says, maybe the kids in the middle of their homework, that they can go on their phones and pay.
I would imagine.
But then what about
because look at how it works with the cell phone service, right?
Yeah, but what about the folks at the bottom of the totem pole, as the article also mentioned, that really can't afford that, but they still have lights. Yeah, their bills are going up, but at least they could feed the children can still do their homework, etc., etc.
So
and they can continue to pay down.
Man, before I get off. So Jamsta, what became of this topic about renewable energy and the solar farm project? I mean, they built up the people's hopes about that solar farm project, and they said that they was going to move the country into getting the electrical bills decreased. Is that project now going to be totally abandoned? I mean, this is like a new finance. Even with this concept that they're coming up with, me personally, I don't agree with that. I don't like that. But it seems like it's a system that countries are moving towards.
But
so,
like my friend says, I take the point that just like with your cell phone service, it's just a choice: prepaid, postpaid. It's basically prepaid electricity. That's what it is.
Yeah.
And I take the point that it's a choice. You'll just choose which one is best for you. So who am I to say that doesn't work better for some people, right?
Yeah, I got you. As we learn more, as we go forward, maybe people might see it differently, But initially,
and the person,
they're going to change in anything.
The commenter on the wall, Gwyneth on the wall, who raised it, actually, she also raises another good point, which is similar to what I was thinking. She says, I believe the whole idea of that is to ensure that people pay their bills.
Yeah.
They are afraid to disconnect people, so they have to come up with, an
Ways.
expert. Yeah. So
that's a good point, because I noticed, right, that they're starting to cut off people's bills. I mean, lights. I had a experience with that recently. They're starting to cut off people's lights if you don't pay your bills. So this is probably one of the reasons why they want to move towards that. But I'll leave that there for now, man, and I'll continue listening. Thanks, man.
Okay, cool. Yeah, so I think that's fair. People should pay their bills. Yeah.
But it's people should pay their bills, right? But what becomes important for the person that's on the bare minimum, that has sick children, whose children need to be fed? What is more important? The sick children, the bills? Because one may argue you could buy a candle and still have light, but you have to make sure that your kids are fed, your kids are. But
it's
guess
interesting.
it's a way.
It's interesting that if you have, imagine you have prepaid electricity, you have, some people.
Everything might become prepaid soon.
Yeah, some people might have prepaid internet, because I don't think they don't have that, right? No.
I don't think it's here now.
Yeah, but
if anybody knows, they can correct us.
I heard that Antigua is sort of like that. Well, it's postpaid, but I heard that. Whereas, we have a flat rate and it's basically whatever you use. I heard that in Antigua they have you pay for a certain amount.
I had top-up system in Antigua.
For internet?
No.
Oh, okay.
No, for my cell phone.
Oh.
I had a normal internet, normal electricity. No. I paid monthly bill for those. But for my phone, I didn't think I needed a bill phone, because most of my time was spent here when I was off from work. So that phone was only to call the driver to let them know what time I'm coming, etc., etc. Yeah.
So did you guys? So was it Liat picked up you guys?
Yeah.
Oh,
But
cool.
you had to live in a specific area.
Oh.
A specific radius.
Okay. So
to the airport.
So if you live behind God's back, no dice.
Yeah. Find yourself to work. Only the flight attendants were picked up though. The pilots had to find their own way to work. Guess
even if they lived within the area?
Payment wise, yeah. They work for way more than the flight attendant.
Oh, okay.
Yeah.
Okay. Okay. I could see that.
Yep.
And I guess most of them had cars too, right?
Yeah, of course. Yeah. Or they rented somebody to take them to work. Yeah.
Okay, let's take this call. Caller, go right ahead.
Good morning.
Hi.
Good morning. How are you?
Very good. How are you guys doing?
We're doing okay.
Okay for today.
Very interesting discussion. I think we need to look at the way we go about doing things and setting up these programs. I'm not saying if they're good or bad. One thing may work for you, it may not work for me. But I had an experience the other day that really touched me, because a person came to me for some help. They had just come from the services department over here, where they were trying to get on that same program you were just discussing. And like the caller said before, education. They told the person they had to go and get a cell phone and an email address. Now, honestly, this is not a person that would use email. They're just barely making it. And they have a disability. They don't even have a cell phone. So how does this program help the persons who really need this type of help? Are we reaching those who really need this help? What are we looking at? How are we educating our people to prepare themselves? And I know we all live in a technology world right now.
Yeah.
But not everybody's going to have that. How do we help and get to those who don't have that? We have to take a serious look at that, because we're missing the people who really need this help.
Yep.
We are missing people who really need this help, and perhaps there are people who are getting this who should not even be getting it.
But why didn't you said the person went to the department, right? Didn't the department see the need to maybe alternate to help this particular person since this person is in dire need? Because as you rightfully
That's a good question. I picked up my phone and I actually called the department, but I couldn't get through to anyone.
Oh, wow.
To ask the question, how do you go about helping? This person needs help. Can you guys get them a cell phone? Can you help them set up an email address? And that didn't happen.
Wow.
They told them you have to get these two things and come back.
Oh, wow. But they didn't think to put themselves in that person's shoes, although that person might have explained themselves to them, and see how they could have gone to their higher ups and see how they can help, because there must be a way to help somebody like that.
Absolutely. And this is not this person is faking it. They could do this. Everybody knows this person, and this person really needs that help, and they don't have that.
I think, you raise a very, very, very good point. They're assuming that the absolute floor for entry is, you have to have a cell phone. But you as you point out, it's not everyone that has a cell phone and is even tech savvy enough, or even can even afford the cell phone. So yes, that poses the question: how are you gonna stop people like this example you just used from falling through the cracks? Yeah, very good, very good way. And I gotta say, I hope the authorities are listening.
It saddened me that the social services department was handling this way, because aren't those the people that people go to when they need help?
Exactly, and this is
not prepared for a situation like this.
Exactly, and this is a perfect use case for, I guess you could say, better social service synergies between government agencies and the ministries that do deal with social services. Like in a case like this, Skellig has a situation like this. They can get together with maybe one of the network providers and maybe welfare, and you figure out, hey, can we buy some rock bottom cheap phones that whatever software they're going to use to do this prepaid electricity, whatever it runs on, that there are going to be some cases where there might be 200 phones. We could give away these phones to make sure these people. But even
because what if you give them the phone and the person can't afford to top up the phone? But they said there were other social programs available. So I don't understand how they send this person away without assisting them, even with the other social programs that don't require a cell phone.
Exactly.
So maybe in a case like this person should just be. I know there are people who get the electricity. There's a very small cohort of people who get electricity free as part of the social service.
I wouldn't say free, because government still had to pay for that.
Well, yeah, but you know what I mean. Where, because maybe they burn below a certain amount, and so I don't know if that's this might be a case where this person should probably be made exempt from the prepaid regime, right?
Yeah.
I don't know. Let's hope the authorities are listening, because you raise a very good point.
I hope they are, and I hope that we make some changes, because you have people that are falling through the cracks, who desperately need help, and I'm telling you, this person is one of them. That was told you have to have a cell phone and you have to have an email address, and I'm thinking, I smile to myself, because I'm thinking, an email address?
Exactly,
like, really?
which means the person has to have a computer. Exactly.
Have an email address?
Exactly.
He needs to have a cell phone. I think he said to me that he had lost. He had a cell phone before he lost it, and he don't have the money to buy another one.
What they're leaving out is the fact that having an email address means that you're supposed to have money to pay for a monthly internet or even a data plan. So
Exactly.
so it's just right. So it's revealing a whole.
And the monies can't work for that.
Yeah, it's revealing a whole bunch of other knock-on problems with this system
if that person lives here and can't get to there where he could probably get free Wi-Fi, then that person is solved.
There you go.
Well, you know what? What if they had the cell phone and they get onto this program and they cannot maintain that cell phone and that email? How do they do the following month to get access to this program? How do they continue?
Yeah, because what if the person don't have electricity to charge a phone too? There's a lot of implications. So we really have to look at people's needs from different angles.
Yeah. I guess in a weird, in a weird way, in a weird way, you could argue that this is the kind of thing that perhaps makes social services have to be expanded to include these kinds of things, because in the US they actually have like welfare cell phone service for people for people who can't afford it and so on, like homeless people, and where they give them a phone and they'll top up the phone accordingly. So wow. So let's hope they're listening and they're thinking about all the ways that this could go wrong. And when you start thinking about like all those things we were discussing, we realize, boy, this is not going to be as easy. And government. This is like, I always have this argument with Gregory. Gregory has this anti-government stance, and I keep telling him there are just certain things that only government can do, because government should not be about profit. I'm not saying you should just spend money wastefully. I'm just saying a government is not a business. A government should be working for the common good, the public good. And all these things we were just discussing with the caller and the commenters, these constitute the public good. And you have to think about all the ways in which you can make these things work, make these things frictionless for the less tech savvy, the less the poor, the disadvantaged, and all of that. So yeah, let's hope they're listening.
All right, guys, have a good day.
Okay, you too.
Thank you for that win.
Yeah. Okay. Yeah, that was that raises a very good point, because it seems as though in their minds, everybody has an email and everybody has a phone. Oh, so just go off and get an email and come back with it. No. I'm not saying the number is... Actually, the number is probably going to be bigger than we think. The number of people with that issue. Yeah, the number is probably going to be bigger than we think. So it seems like a rethink is in order as far as making sure those people don't fall through the cracks.
Yeah.
Because, like I said, that person, you're assuming that person has data/internet, whether it's internet at home,
steady electricity,
and or a phone, or can even afford data. Most people can't even
afford a top.
Exactly.
That's because why I said to get to Wi-Fi, they might live all the way here. That's a bus payment to get to somewhere.
Yeah.
Depending on the population of the village, and because most people lock the internet, lock it.
Yeah, I remember those days.
So you cannot lean on your neighbor anymore for Wi-Fi.
Actually, remember those days
you have to you want to go town to sit down by Flow to get Flow's free internet to do what you have to do. That's money again to get there, depending on where you live on the islands.
I remember those days when Wi-Fi first came in, and you'd be looking around, and most of the things were open. People weren't thinking about,
Yep. Now
everybody's got their stuff locked down.
Lock it.
10:01. So this is where we wrap up.
Yep.
I think we had a good conversation this morning. I have to give you back your numbers.
Yeah. Oh, okay. I'll collect it in a bit.
Yeah. So I hope the powers that be are listening, and these are things we need to think about. Not everybody has internet. Not everybody has data. Not everybody's even tech savvy. Even if they can afford it, there are a lot of people who maybe can't afford it. They're just not tech savvy.
And we know the elders don't want the phone.
They don't want the phone.
They're not. Some are willing But others are just not willing to learn. Not no, like I ain't able too much. Yeah,
exactly.
So
Yeah.
we have to be considerate. I know the elders are not included in this one because they say there are other social programs for them. But what happens when they become included in future programs that you have that requires them to have a cell phone,
Exactly,
an email address, etc., and they live by themselves?
And
who's gonna help?
And of course, we don't know the circumstances, but you know, the caller talked about them telling the person, "No, go off and get a email." They need to do a little better than that. That kind of approaches. This is where the social services people probably need to work out some kind of system with the social services and the carriers, and because you shouldn't just be sending people away and saying, "Oh, go and get an email," because not everybody has a computer.
That's rough. They could have tried to assist the individual with something else.
Yeah.
Oh boy.
Yeah.
We just have to be kind. Choose to be kind. Choose to be choose empathy. Wonder if you were in that person's shoes. We do not, even if that person ate, we do not know what circumstances they live under. We do not even know if they have electricity. What if they're in a race too and pain can get them to get back their lights? We don't know. So we have to be kind to people. And I know it's often said that government workers are the worst. Come on, let's change that narrative. Let's hear, "Oh, I went to the passport office and the girl was so smiley, she was so nice," or wherever in government we go. Just let us change that narrative. Let's choose today to be better, not only for ourselves, but for everyone around us. And just think of what our society will look like.
Yes. Powers that be, remember that a person that's probably going to be paying for prepaid electricity most of them are probably going to be doing prepaid cell phone service, if they have a cell phone, if they can even afford a cell phone. And probably if they live at home and they have maybe internet, and then you don't know if everyone can afford the internet. So there are a lot of things you're going to have to think about before you roll out this thing and make it work properly. So
you see, there's a comment there, Jamsta. This commenter says in England, you can buy your electricity top up at a supermarket outlet. So there's a lot of things that have to go into play before we start all of that. That'll be good.
Yeah, someone says
or kindly invite someone from the social services department to the show to address these concerns, as most of our vulnerable persons need this assistance. Okay, so Ms. Clark, if you're listening, can you come back and assist us in informing and educating the general public? Thank you.
I can't resist this one, because this is one of those terms of phrase that I
we can reach out.
Kindly. Do people unkindly invite people or unkindly do anything? It sounds funny when people say, "Kindly do so and so." I'm like,
no, but they're asking nicely, because they could say invite.
As opposed to unkindly? Am I going to call him and go, I order you to come to Island Tea and explain yourself. I mean, I'm just playing. Okay. So, you guys have a nice day, and we'll be back tomorrow. Don't forget, come back tonight, Tuesday night. We got, we have Troy Biff Mills with his sports talk show at 7 o'clock tonight, from 7 to 9. It's called On the Ball. So, that's usually video stream, so you can check him out tonight for that. Of course, Wednesday night you have Real Talk with Lavi from 8 to 9. Okay, so you know what to do. Everyone have a great day. We'll be back with you guys tomorrow on the Island Tea. You got nothing to say?
No, I already said my piece.
Okay.
And
Okay.
Be kind.
Just wanted to hear I always have mellifluous voice again before we wrap up.
Okay.
Wow, nice. See you.
Have a good one.
Okay.